I just did, I believe.
All right, thank you all for joining us for Cycle 2 with the South Jersey Institute for Population Health, our Cycle 2 funding initiative for 2022. This is the informational webinar. So today we have an agenda. We're going to talk to you a little bit about the South Jersey Institute for Population Health, our mission, our vision, and our focus. Then we're going to talk to you about the purpose of the funding initiative. We're going to identify key dates, and we're going to talk about the evaluation and review process. And then we're going to finalize our session here today with questions and answers. So we've received a number of questions, and so we have slides that will have those questions with answers. We will ask everyone to submit their questions in the Q&A function or the chat function, and we will answer questions at the end of the presentation. So welcome to our 2022 funding cycle initiative. So I am Nicole Vaughn, and I'm an associate professor at Rowan University in the Department of Health and Exercise Science. I teach in the Public Health and Wellness degree program and have been doing community-based participatory research for 20 years up and down the East Coast. So I have a lot of experience sort of working with community academic partnerships on lots of areas related to health disparities, reduction, and advancing health equity. And my colleague, Sarah Allred, can introduce herself.
Hi, everyone. I am Sarah Allred. I am an associate professor in the psychology department at Rutgers Camden, and I am excited to be a part of our brand new PhD program in prevention science at Rutgers Camden. I'm also letting people into the waiting room as we're talking, so excuse my disorganization. I do a variety of work related to one line of my work is related to basic science work in perception and memory, and I'm also do work related to the social determinants of health. And along with Nicole, we've been doing a variety of work trying to improve health outcomes in Southern New Jersey by aligning both community partners with academic partners. So together, Nicole and I have worked to sort of, along with the joint board, and Nicole will talk a little bit more about this, to launch the South Jersey Institute for Population Health. We had a great first funding cycle last year. And I will be on sabbatical for the 2022-23 year. And so I also want to introduce Naomi Marmerstein, who has graciously agreed to take over as the interim co-lead from Rutgers while I am away on sabbatical.
Thanks, Sarah, and hi, everybody. I'm excited to step into this role. I'm also in the Department of Psychology at Rutgers Camden, and I'm also in the Provost's office. I'm Associate Provost for Faculty Affairs right now. And I'm really excited to work with Nicole and the rest of the South Jersey Institute for Population Health team, and also many of you, I hope, as well. Please feel free to reach out to me for Rutgers-related questions, requests for help finding partners, things like that. I'm here to try to be helpful and make things on the Rutgers side move smoothly for the applicants and grantees as things move ahead for this cycle. Thanks.
Yeah, I'm really glad to work with Sarah and with Naomi. So Naomi, we're looking forward to this cycle too. So as you can see on the slides, we have a small but mighty staff that work with us. So Chriselle Allen is a part-time public health analyst with Rowan University. And we have Corey Hoffman, who's works with the Rowan University Rutgers Camden Board of Governors. So he's with the joint board. And myself and Naomi will be working on cycle 2 funding. So by way of introduction, so the South Jersey Institute for Population Health was established through a state grant to Rowan University and Rutgers Camden's Board of Governors. And really the idea is to really bring together the medical, educational, research, and community partners really to benefit the residents of Southern New Jersey. We really are focused on improving health equity, reducing disparities in Southern New Jersey. And we have a focus on population health, population medicine, public health approaches, health promotion approaches. And so we really want to make sure that community and community stakeholders are at the center of the work, and impact of New Jersey, Southern New Jersey residents is at the center of the work. So that's really the impetus for the Institute, and that's what all of our work is designed to do. So our values are really central to our work. Sarah and I spent a lot of time with the team really going through what the values are. And we really feel like during our first inaugural initiative last year that really came through in the projects. We really are interested in collaboration. So really making sure that authentically building connection between partners within the region, really focusing also on innovation. So really bringing in any new ideas, new sparks, really to have a sustainable impact within the region. And then impact, right? So making sure that what we are able to offer to our region can be inclusive and also have a lasting and sustainable footprint in the 7-county region in Southern New Jersey. So we are designed to really serve as a hub for research and collaboration and connection. Our purpose is fivefold: health equity, as I've mentioned. Really, our focus is on the 7-county region. So you can see the counties that are included. So that includes Burlington, Camden, Gloucester, Cumberland, Salem, Atlantic, and Cape May counties. So all of the research that we're doing and that we're inviting into the portfolio will be in those areas. And then thirdly, really focusing on urban and rural issues. So the funding that comes to us from the Institute is coming from the state government. And so really they want to focus on issues that are both urban and rural in nature. And then we want to make sure that there's new ideas and that we have a space for new data to be generated. And then our fifth purpose is really partnerships. And we really thought hard about how we want to structure this, because we really want to bring a lot of new ideas and new energy into research and into work that's happening. And so we have 3 different categories. We have teams for new teams. So for partnerships that are newer and are just coming together, there's a category for you. There's also a category for more established teams. So teams that have been together 6 months or more, you can submit into that category. Previous awardees, so individuals who received Cycle 1 funding are eligible to apply for Cycle 2 funding. Your funding must be unique and distinct, so it can build on, but should be a new project, and you have to show that you've made progress on the first cycle, so we didn't want to exclude anyone, but then that's another category. And then finally, larger projects, and we're going to talk a little bit about that in the coming slide. So some key dates. So we opened the call for proposals on May 19th. And so hopefully the fact that you're here means that you received it from many of the different channels that we have been distributing through. So please, if there's others that you know couldn't make it, please do share this RFP with them. It is open through June 27th. We will be opening the application portal on June 1st. So right now the RFP is out. The application portal where you can begin to submit your proposal will open on June 1st on our website. And what we're asking for is a brief letter of intent. And so in the design of this funding announcement, we really did not want to make it so onerous on the applicants. So the areas that you see in the RFP, and we'll talk about those in a coming slide, really are designed to get you to think concretely and succinctly about your idea. And so we really want to sort of get those ideas there and make sure that everyone is not sort of burdened down by sort of a very extensive application process. And so we did that last year, and we got so many great ideas. And so we hope that that process, we know that that process works. And so we would like to continue that. So then we will review the LOIs, will be reviewed by committee and staff. So there'll be a review committee. That'll be completed by July 20th, so mid-July. Then applicants will be notified to participate in the sandbox meeting around mid-August. And so we'll talk a little bit about what the sandbox meeting is designed to do. And then those that are invited from the first stage into the second stage, which is the sandbox meeting. The sandbox meeting will happen on October 14th, and that will be at the Joint Health Sciences Center in Camden, New Jersey. After that meeting, where you'll have time to work with your group as well as a facilitator, as well as learn more about the initiative and more time to really shape your ideas together in person, then your team would submit a full proposal, and that would be due by November 18th. We will then have a secondary review by committee and staff that will happen in mid-December, and then award decisions will be made in mid-December, and then projects would begin mid-February 2023, and then would be released for 1 year. We will have reporting requirements, so each quarter, each team will submit a quarterly report, and right now that's designed to be a few pages, a couple pages, so it's not an onerous court reporting process as well. And then we'll have a final report due in the summer of 2024. So for evaluation, one of the things that we wanted to make sure is that we understand as partners are coming together with this initiative that there are new collaborations that are happening. So you do not need to identify all of the academic and community partners at the letter of intent stage. The letter of intent stage, it would be great if you have 2 of the 3 required partners, and we'll talk about the required partners, right? So you would need a Rutgers Camden partner, a Rowan partner, and then a community partner. So if you have 2 of the 3 identified, you can request and ask for us to facilitate and help find potential other partners. We're happy to do that and happy to be of a resource. So the focus of the evaluation will be what population does the project focus on? What area are you focused on? What population are you focused on? Elders, or are you seniors, youth? A particular population with a particular health issue, right? That's really broad. The other area is capacity. Does the project build the community's capacity? We want projects that just aren't academic in nature, but projects that also build on what the community assets and the community things that are going on. And how do those learnings help build the capacity of the project over time? Disparities. Does the project serve to reduce health disparities or advance health equity in the region, right? Is there a focus on sort of core to the mission? Also, will your project be able to have data that can be shared? And so that is really key to us. We really want to build and become a data hub for data that are really important to Southern New Jersey and that are so desperately needed given the health disparities that we're facing. And then finally, does the partnership sort of generate a new partnership, or does it strengthen existing partnerships? We really want to understand how your team has come together. And like I said earlier, your new partnerships are evaluated differently than existing partnerships, as well as previous fundees in this process. So for the review process, so the highest scoring projects will be invited to the sandbox meeting in October, but your initial LOIs, so your initial letters of intent, are reviewed by the SJIPH staff, and then they're submitted to reviewers. The reviewer team will comprise of 2 faculty from Rowan University, 2 faculty from Rutgers Camden, and 3 community stakeholders. And those faculty are to be determined, and those faculty will not have submitted projects under this funding call. So they will be independent reviewers. The scoring criteria, and these scoring criteria mimic the areas that you are asked in the RFP to write about. So the scoring criteria will be 5-point scale, and it'll focus on the project idea, the team that you have, the data sharing capacity, the impact that you'll have on the community and the community, as well as scholarly impact, ongoing sustainability, as well as the budget. Now, with this funding cycle 2, there are going to be 2 distinct budgeting tracks. And if you notice from the RFP, you can see that. So for track 1, we will be funding up to 12 projects funded at the $25,000 range. All right, so that's a total of up to $300,000. And all project teams are eligible for track 1. So that means all types of project teams, whether that is new teams, established teams that are coming together, previous funding, previous awardees in cycle 1, they're all eligible to submit to track 1, okay? We are excited that we have track 2 this year, and track 2 will consist of up to 2 to 4 larger projects that can be funded between $50,000 and $100,000. And as you can see, there's that range, but there's a total of $200,000 that's available for larger projects. And for these projects, we only want established project teams that can show that they have preliminary data, and in order for them to be eligible for track 2 funding. We also want teams that have a history of working together for 6 or more months. All right, so for those larger projects, we're really looking for a team that's really built some momentum together and working on some ideas and are looking to expand some of that work that they've already solidified and gelled as a team. Okay, so now we're going to turn to some of the questions that we know that people have. And so I want to talk a little bit more about the sandbox meeting. So the sandbox meeting, so what is the sandbox meeting? So the sandbox meeting was designed for letters of intent that were selected by the reviewers to move to the next stage. And we sort of came up with this term, or used this term that's out there, sandbox, that time in the sandbox to sort of play and think and work together on a particular idea. And so that's what the goal of the sandbox meeting is we understand that some of these partnerships are new. We understand that some of these partnerships might be established, but it's hard to get in a room together to work together. And so we were really successful with the sandbox meetings last year, and really think that that's a critical element of what SJIPH is intended and designed to do, which is really to foster collaboration and really bring people together. And so we really think that it serves as that incubator for partnerships. Who's required to attend, and will it be in person? Yes, we will require individuals from each of the teams to come. So there'll be one representative from Rutgers Camden, one representative from Rowan, and one representative from the community partnership invited to the sandbox. That event will be held at the Joint Health Sciences Center, and we will be following all state related guidelines related to COVID at that time. We will likely have the sandbox meetings in sort of 4-hour blocks, as we did in the past, in order to make sure that there's enough distancing and spacing across the building for breakout rooms. Will invited projects require Rowan University and Rutgers Camden researchers? Yes, for each project, we will require Rowan and Rutgers Camden to be a part of it, as well as a community partner. Priority is going to be given to projects that have Rowan and Rutgers Camden faculty collaborations, and additional partners from other universities can be a part of the team, but the main team must be from Rowan and Rutgers Camden. Okay, so in terms of partners, so who counts as an academic partner? So we have faculty, tenure track and non-tenure track faculty are eligible, postdocs, staff, doctoral candidates are all eligible. In terms of eligibility, in terms of the required academic partner, Rutgers Camden, and for Rowan University, it includes Rowan University Glassboro, Rowan School of Medicine, and Cooper Medical School of Rowan University. There are some restrictions on the funds. So funds really should focus on percent effort for the staff, no individual person receiving more than 20% of the grant funding, an hourly student wage, supplies, materials, mileage reimbursement, that's all can be included, as well as travel to attend professional conferences, software and data analysis and evaluation. So non-allowable costs include food except as it's related to human subjects research. And then you can see equipment not exceeding $3,000 and publication subvention. There is a cap of 10% indirect costs F&A because these are New Jersey state government dollars. And this year the funding is up to $25,000. Last year the projects were $20,000. So we recognize that we want to put more money towards the direct research projects. And so, and that allows for more dollars to go in that direction with the $25,000. Will data collected be required to be shared with SJIPH? So we're requiring all projects to have a data sharing plan, but everything that you collect, we understand cannot necessarily be shared due to confidentiality or other issues. But we really are designing our institute to be a hub for data. So we will want to know what pieces can you share, because a lot of these projects are really innovative and really bringing lots of new ideas to the table. And we really want to be able to show the impact of that work and really get information back out to the public. One of the other questions we've received is sort of, what if I don't know a Rutgers or Rowan or Rutgers Camden academic partner individual? And that's okay, we understand that. We would want you to look through the websites of each university as a first step, really, to identify potential partners. And then you can also email us, so info@sjiph.org, and our staff will do our best to really identify potential partners at the universities so that you can reach out and explore your ideas. These will only be suggestions. These will not be required. We'll just sort of give you our best knowledge of who we know sort of in our respective universities and across our fields to connect you with to get you started. So as Naomi mentioned, she has lots of contacts at Rutgers Camden, and then I have contacts at Rowan University, and we can work to help find and connect people, and then you can explore together on your own if that's a partnership that would work.
Nicole, can I hop in here just for a second?
Sure.
So I think as Nicole, with both of these last two questions here, both the data question and the academic partner questions, or a community partner, as Nicole mentioned at the beginning, we have both long-term and short-term goals with SJIPH. So we're, here this year, we're funding specific projects, but SJIPH has this goal of really trying to connect people around our region working on similar projects for, years into the future. And so we understand that a lot of these partnerships aren't already in place. And part of the goal of this funding is to facilitate the creation of those partnerships, to facilitate the creation of data that we can then be the infrastructure to spread throughout the region and connect to other data throughout the region. So that, although maybe some of these requirements seem like, oh no, this is too much, we're really thinking about this from the perspective of trying to build that capacity. So when you submit these LOIs, even if you're not quite sure how your data might be able to benefit, put some idea in there, and then it's part of our job on the administrative end to partner with you to kind of get to that point where we see how these projects can be connected together throughout the region in the years to come. Okay, I'll stop talking and turn it back to Nicole now.
Thanks, Sarah. Okay. So in terms of funding and focus, we've gotten questions before around, can the funding support programs as opposed to research? So absolutely, so the funding can support programs if there is a corresponding contribution to research or data that can help really inform the region. So it's just not sort of data just for programs specifically, but programs that can generate data that can be used so that other programs can learn from what you've been able to do. So we really do want to make sure that there's data that is generated as part of your project. And so that really, and if you're on the community side and are interested in sort of figuring out what those questions can be, that's really what this institute is designed to do, is really to connect you to faculty that could help work and help you shape the question in a way that data can be generated to support the ideas for future projects. Does the project have to be in Southern New Jersey? Yes, our name is the South Jersey Institute for Population Health. So we really are focused in Southern New Jersey and one of the 7 counties that were listed before. One of the things that did come up before, if my project is invited to the sandbox meeting, what are my chances of being funded? So our goal really for the sandbox meeting is for it to be a collaborative environment. And we really did see that in the 2021 cycle where it's not competitive. We really want to be able to fund most of the projects that come to the sandbox meeting. And so we did see that connection that was happening and people were sharing ideas and potential partners and different things. And we want that type of energy to continue. So once you sort of get through the first stage and are invited to the sandbox meeting, you will go through another review of your project when you submit your final full proposal. But our goal is really to have that time at the sandbox meeting for you to shape, get feedback, and really sharpen that idea so that it has a high likelihood of funding. And then, as I mentioned, can previous awardees apply for cycle 2? So yes, previous awardees are welcome to apply for cycle 2 funding if 2 conditions are met. That cycle 2 projects must be distinct and different from cycle 1, and the teams must demonstrate significant progress on their cycle 1 funding. And then there were some questions around, is this federal or state dollars? So as I mentioned, these are New Jersey state government dollars, and so there's a 10% indirect cost cap. Are there names of previous award winners? So last year was our inaugural year. This is our 2nd year. So yes, you do have the benefit of seeing the cycle 1 award winners. They are all listed. We just relaunched our website. And so they're all listed on that website. So you can see the projects that were funded in cycle 1. Does this project have to really focus on research at this stage, or is there an opportunity for an application-based initiative to align with the Institute's mission? So we're really looking for projects that engage community stakeholders and academic partners together. We really want there to be, as I mentioned, sort of a research question and data that can be generated that can help advance understanding of health related issues within the region. Given that in Southern New Jersey, we know the data show that there's lots of areas of need. And so we really want to make sure that we're sort of seeding work that can generate that data. And then in terms of specific health issues, we're not prioritizing any specific health issues. So it's really open and really broad. And as you can see from our Cycle 1 awardees, we have a range of topics, a range of populations, a range of different areas and regions. So we really want to cast a wide net that's open to as many people as possible. So there's no restriction on the type of health issue that you may focus on.
And Nicole, I'll add to that too, that we think of health through a really broad lens, including social determinants of health. And so there can be projects that aren't even looking at specifically at a health outcome if it's at a health issue that we know is, if it's on an issue that we know is related to health outcomes. For example, one of the projects that we funded in the first cycle was related to looking at broadband internet access, so and things like that. So I've heard a couple of questions about people who are saying, oh, I'm not looking at a health outcome specifically. We're definitely interested in funding projects that are related to upstream determinants of health outcomes as well.
Yes, so I'm going to stop here so we have time for your questions. So as I mentioned earlier, please put your questions in the chat. Sarah and Naomi, I'm going to keep my Q&A slide up. And so you may have to read the question.
I see one about the definition of an established team. So if 2 of the 3 partners have been working together for more than 6 months, but maybe the third hasn't, would that be considered an established team, or do all 3 of the partners need to be working together for 3 or more months?
Oh, great question. So that actually would be considered an established team. And so you can talk about the impact in your sort of impact section of how your work is now sort of including an additional partner and you're sort of bringing someone else. But because that most of the team has sort of worked together, that would be considered an established team. Sarah, do you have anything to add to that, or Naomi?
No, I think that makes sense. Yeah. Yeah. But kind of the goal behind that team question is there going to need to be a lot of time spent developing the capacity of the team to do work together, or are you kind of ready to hit the ground running in terms of a research project? And we're open to both kinds of projects overall, but those track 2 projects should be with teams that are kind of ready to hit the ground running.
Right.
I see a question asking about expectations for the community organization. Are there particular expectations for that piece of, or for that part of the partnership?
Yeah, so that's a great question. So the expectations are open, right? We really see this, and we sort of have talked about this as, we really see this as equal partners, right? We really want the community to contribute their expertise fully, the academic partners to contribute their expertise fully, so that it really is synergistic. I think, our goal is really to make sure that we have like a really strong, we sort of call it the 3-legged stool together, and each one of those are integral, right? Each one of those partners is equal and integral to the success of that project and the success of the Institute. So really the community partner, along with the 2 academic partners, you guys decide that as a team. And as you can see from, you can see on our relaunched website with the projects that were funded in cycle 1, that there's some projects where the community was the lead PI and the 2 academic partners were co-leads. There's projects where the academic partner was the lead PI and the other 2 came in. So it really can go a bunch of different ways, and we're really open to that. Sarah, is there anything to add, or Naomi?
I think you got it.
All right.
We have a few questions about specific entities as partners. So I'll just kind of put a few together. Could Cooper Health be a partner? And what about programs like the Rutgers Camden, like the VA, the Violence Prevention and Victim Assistance Group, or Rowan's Wellness Center? Would those qualify as university partners?
Yes, so health systems qualify as community partners. So Cooper Health would be considered, someone from Cooper Health would be considered a community partner for the purposes of this. And yes, also on the questions about those centers at Rutgers Camden and at Rowan, staff are eligible as academic partners as well. So as long as there's a person affiliated with the university that's part of that those centers, which they are because they're at the universities, then they would count as academic partners. Nicole, anything to add to that?
No, I think, yep, you covered it. And we had that question before. So yes, health systems are eligible.
Those are the questions that I see. Unless I missed something, I don't think I see anything else.
Okay. So we have some more questions that we can go through if we don't see any more right now in the chat, Naomi. As we established, it's open to new and established teams as well as previous awardees, and open for larger projects this cycle. We also have talked about projects in identifying matching funds. So if there are in-kind dollars that you are able to identify, or matching funds that you're able to identify, or you're leveraging other funds as part of your project, you can include that in your application. There is no requirement for matching funds. But if you have that, that's fine, that you can include that in your budget. Lastly, we had another question around community colleges or other educational institutions within Southern New Jersey. They can absolutely be a part of this project. However, you will definitely need a Rutgers, Camden, and a Rowan partner. I think we answered this question. So I'm part of a team that's been working together for the project. We'd like to double or add partners haven't worked together. So this would be considered a existing partnership. As we answered before. And
Nicole, I see another question in the chat. Can an application to NIH count as preliminary data? I'm assuming, is that for the track 2 requirement? I think, yeah, the kinds of preliminary data that you would submit for an NIH grant would definitely count as showing established as having preliminary data for track 2.
Yes, that absolutely. That will count. Some additional questions. So if awarded at the full proposal stage, how will funding flow between the entities? So the distribution of funds will come from the Rowan University Rutgers Camden Board of Governors. So it'll come directly from the joint board. And the specific details regarding how that disbursement will happen will be updated at the October 14th meeting. If you're interested in the initiative but don't have a project idea but would be open, we are open to you sending us an email at info@sjiph.org, and we can help facilitate and help find partners based on your other projects that we know of. Can an individual researcher or community partner be a member of multiple projects at the LOI stage? And are there limitations of how many faculty can work together? Yes, individual researchers and community partners can be parts of many different LOIs at this stage. All ideas are welcomed. There's no limits on faculty that can work together on a project, and one lead faculty member from each institution needs to be identified with a lead community stakeholder for all of the projects as we have discussed. Did any other questions come in through the chat?
I don't see any more. I just wanted to add and follow up to this that I would definitely encourage folks who are interested but don't have a specific project or a team just to email the info@sjiph.org with that information. That is one of the ways that we were able to connect people sort of behind the scenes last year. So that's a very valuable thing to do if you're interested.
We have a late, oh, sorry, go ahead.
Go ahead.
We have a late breaking question about the data sharing piece of things. Does it impact the scoring? And maybe if you could just talk about it a little bit more.
Sure, Sarah, do you want to take that one?
Sure. So with the data sharing, it is one of the areas that's evaluated in looking at the LOI. And the way that it's evaluated is at the level of, is it clear that there could be data generated from this project that could be shared with SJIPH more broadly. So it isn't that you need to have a specific data sharing plan or know exactly how you would do that yet. But the idea is that one of the goals of this research is, again, to share data amongst different groups that can be useful for the region in the future. Does that answer the question? And Nicole, do you have anything to add to that?
No, I think you covered it. Like, I think we want to make sure that there is some data that we can sort of think about sort of collective impact of the work. And so thinking about, and we're happy to sort of talk with you, and, you know, once projects are funded, to sort of help figure that out too, because we're trying to understand sort of how to make sure that we show impact of this data across the region. So so one of a couple other questions that have come in. So to be eligible for track 2 funding, are we reading correctly that the team members have to consist of the same members that received cycle 1 funding? No, you do not have to have the same team members as your cycle 1 funding. However, your team must be an established team. So that means you would have worked together on a previous project for 6 months or more, so that you don't have to keep your cycle 1 team together. But if you have another partner, partners that you've worked together, you can definitely apply in the track 2 funding. If the team that received cycle 1 funding applies for cycle 2 funding within track 2, can the project have some crossover with cycle 1 projects? We do want the projects to have a different research question, and they cannot just be an extension of the project 1. And you have to have preliminary data. So cycle 1 projects would need to have generated enough preliminary data before the deadline in the end of June. Okay, are there any other questions coming through?
Oh, I see one. Would a community organization based in Philadelphia working with New Jersey youth be eligible?
Yes, if they're able to identify Rutgers, Camden, and Rowan faculty that they're able to support on that project and work on that project.
Yeah. The key thing is that the population being served is in Southern New Jersey. Yeah. Oh, I see that Kristen lifted up another question. I thought we answered this, but maybe not. What expectations are set for community organizations? And that's just that there's no specific set of expectations for either the academic or community partner. It's just that as the team gets together, the team of partners will decide themselves what the expectations are for each of the parts of the partnership. So in some partnerships, it may be that the majority of the program or the work is the lead community organization, and the Rutgers and Rowan partners are kind of support, and others, it might be one of the academic institutions or the other that's kind of the lead, and the others are supports. So it's really defined by the teams themselves.
Yeah, and we really, like I said earlier, we really want it to be sort of equitable partnerships, like so everybody's coming together and really defining those expectations together, and really working together so that there's not sort of a feeling that there's not shared decision making within the group, and there's not shared ownership over what the project is and the data. And so we really want those teams to come together and really work together to make sure that everybody's on the same page and decide. And we know from doing, decades of community-based research, Sarah and I, that is really a hard challenge, right? And we are here to help sort of facilitate and help that along. We have great facilitators that are available during the sandbox meeting to really facilitate that process and really get to clarity around who's doing what, because that does take some time, but we really want to make sure that everybody's voice, community partner, academic partner, is fully heard, fully acknowledged, and fully part of the project.
And Nicole, you said something in this just now that I wanted to emphasize a little more too, which is that at the sandbox meeting, each of the teams that comes to the sandbox meeting will have an experienced facilitator assigned to their team, and we try to match facilitators with the needs of the specific project team. So whether it's more kind of infrastructure needs in terms of figuring out how to collaborate, or if it's more somebody who has like a data expertise or has research methods experience, we try to kind of pair you with whatever your team needs, so that you can have that opportunity at the sandbox meeting to more fully develop your project ideas.
Right. And the sandbox, so I was going to say one more thing. The sandbox meeting is really a time for a working session. So it's really designed with the bulk of the time with you actually working through a lot of the working with your team for a lot of the details. Naomi, another question?
Yeah, you talked before about this being obviously on health research, but then Sarah talked about how it could be defined broadly, including social determinants of health, anything that influences health and things like that. We have a question about things other than health research. So things I guess that don't relate to health or social determinants of health, whether that would meet the expectations for this.
I mean, we would probably need to have that person maybe email info@sjiph.org with more specifics. I mean, our focus really is on health and health related impacts and outcomes, and really sort of improving health in the region and understanding more about health in the region. And, we, like I said, like Sarah mentioned, sort of it's more broadly defined with the social determinants of health. So housing and food security and education, and sort of those have impact, like health impacts, and employment and workforce. Those all have health impacts, and how you sort of describe and talk about that, I think, is important. So we would need to know a little bit more how far afield it is, because if it is far afield from sort of having any health impacts, then this might not be the right mechanism.
Thank you. I don't see any other questions.
Okay. Well, thank you all for joining this webinar. We will have access to these slides as well as the recording on our website in a couple of days. If you have any questions at all, please do email info@sjiph.org. And we look forward to receiving many applications.
Want to say thank you so much, Sarah, Nicole, and Naomi. This is beautiful. Thank you.
Thanks everyone for joining. We look forward to seeing your LOIs.
Thank you.
Thank you.
you can stop the recording?
Oh, yeah.